It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show, Expresso right here on SABC3. Happy Tuesday and thanks so much for joining us. Of course, Tuesdays are all about health chats. Let's talk the World Health Organization that declared the Covid-19 outbreak an international emergency. Now, more than 16 million people worldwide have been infected, and there's been a rapid rise in cases in South Africa that has now become one of the top 5 worst hit countries. People who suffer from diabetes may be more vulnerable to the severe effects of Covid-19, and endocrinologist Dr. Zane Stevens joins us via video call to tell us a little bit more. And of course, we encourage you to give us a call to ask us all of the questions that you may have related to this topic. The number to dial 021 110 5552. Give us a call, and of course you can ask us all the questions. But first, a very good morning to you, Dr. Stevens.
Good morning, guys. Thanks very much for having me.
It's so fantastic to have you. Thank you very much for making the time, Dr. Stevens. Let's talk about diabetes. Are people with diabetes at a higher risk of having severe illness if they get infected with COVID-19? Is this true?
Yes, that's very true, and you make a very good point. So it's important that people living with diabetes understand that their risk is not more in contracting the virus. We're just worried about those individuals, if they do get infected, that they may follow a more severe form of the illness. So they may be more likely to require admission to a hospital for supportive care, including oxygen support. So that's really what we're worried about.
Yeah. So are the risks similar for people with type 1 and type 2 diabetes, or is it different?
So it's a very good question. It is different, and the best information we've got about this is from the UK, that have really looked carefully at their admissions. They found that about a third of all of the people admitted to the UK with COVID-19 in fact had diabetes. And the risks between type 1 and type 2 were different. In fact, those with type 1 diabetes individually had an increased risk of being admitted, but obviously the numbers of people living with type 1 diabetes are a lot less than those with type 2 diabetes. And those with type 1 diabetes who were most at risk were older individuals who've had the condition for a very long period of time, who had complications from their diabetes, and in fact had also become overweight or obese. And I think overweight and obesity is a very, very big factor in a poorer outcome in this condition.
Well, you know, Dr. Stevens, I think without a doubt, diabetes is easily one of the most misunderstood illnesses out there. What are the most common signs and symptoms of it?
So unfortunately, many people, because obviously the most common form is type 2 diabetes, go undiagnosed for many, many years. So it's estimated in our own country, only about 50% of individuals know that they have the condition. And part of the problem is that early on, people may in fact have no symptoms. So in fact, screening for this condition is vitally important. So if you've got a family history of diabetes, if you yourself are overweight or fall into the obese category by BMI, you should really think about screening yourself for the condition. As the levels of blood sugar start to rise over time, you may then start to develop some of the more commonly known symptoms of passing large amounts of urine, feeling thirsty, and really then potentially even starting to lose weight as this becomes more severe. But I'd like to emphasize that often this is undiagnosed, and so screening is very, very important.
Yeah. So what can people with diabetes and their loved ones then do to cope with the current situation, would you suggest?
So the most important thing really is not to panic. I think that you've got to try to prevent yourself from becoming infected in the first place. So apply all the social distancing, mask wearing, hand hygiene that we should all be following at the moment. Number one. And number two, try to ensure that your diabetes is as optimally controlled as possible. So studies have shown us that if you can keep your blood sugars very well controlled, typically between a range of 4 and 10, that you're doing a lot to reduce your risk of having a more severe form of this illness. So check in with your doctor, make sure that you're testing your blood glucose regularly, and stay on your treatment. This is really a time to be focusing on your health.
We hear a lot about exercise and diet when it comes to people with diabetes. Why is it so important for these individuals to be physically active and to eat properly? For example, what does a diabetic diet look like?
So obviously, one of the biggest risk factors for the development of type 2 diabetes, which as we said is the more common form, is overweight or obesity. So everything that you can do to maintain a healthy, normal weight through both diet and exercise is going to go a long way to prevent you from becoming somebody with diabetes in the first place and to manage the blood sugar effectively. So exercise, a healthy diet is really important. I actually try to counsel my patients that this isn't a diet. What we're wanting people to be doing is following just a very healthy lifestyle, which is something which is applicable to all of us, not just those living with diabetes.
Awesome, brilliant advice there, Dr. Stevens, and thank you very much for joining us for our health chat on this Tuesday. I know that you'll be answering some of our viewer questions a little bit later on, and we encourage you at home to give us a call. That number 021 110 552. Call us with your questions regarding diabetes and COVID-19. These are especially difficult times for those with that particular condition, as it presents them with a higher risk, not just of infection, but of course with the severity of the symptoms that you might be experiencing. And of course, Dr. Stevens will be there to answer all of those questions a little bit later on. But speaking of exercise, I think we're about to do that right now. Get that body in shape.
And quickly.
It's my feel-good breakfast show.
Welcome back.
Yes,
yes, indeed. Welcome back to you too, Tabzi.
Yeah, welcome back, everybody. Welcome back. We are continuing here on your Feel Good Breakfast Show, Expresso on SABC3. Our health topic this morning with, of course, endocrinologist Dr. Zane Stevens, who's still with us and is answering all of your burning questions on diabetes and COVID-19. Of course, you did give us a call on 021 110 552 and sent us your questions on our Facebook page as well. Thank you very much for that, for all your questions that you've sent through via our social media. Dr. Stevens, welcome back.
Thank you.
And we do have two callers on the line. We'll start off first with Sonia, who's calling us from Port Elizabeth. Good morning, Sonia.
Good morning.
Thanks so much for your call. So what is your question regarding diabetes and COVID-19?
Good morning. Yes, I've got a question on the concern of opening the fast food outlets in the COVID time due to the effect it's got on diabetes. If Doctor can just explain to us and to the people out there.
Dr. Stevens, would you have any comment on that, the effects, I guess, of fast food on diabetic patients?
Sure. Thanks, Sonia, for your question. So I think it is important that somebody living with diabetes is careful in the types of fast foods that they choose. As we know, many fast foods tend to be high in the bad fats, carbohydrates, and often a lot of hidden refined sugars. And if those are the cases, those are exactly the kind of things that people living with diabetes should be avoiding. So people living with those conditions need to be rather careful, because obviously the focus needs to be on maintaining a healthy weight and lowering specifically the carbohydrate intake to be able to avoid their sugars from rising. So I think it is important to be very careful in the selection of whatever fast food somebody with diabetes would choose.
Yeah.
I suppose for Sonia, it's making sure if she is looking to start a fast food outlet to think about those requirements for a diabetic patient, Sonia.
Yes, thank you very much.
Thanks so much for the call. We also have on the line Bromley joining us from Johannesburg. Good morning, Bromley.
Good morning. Good morning, Doc.
Go ahead, Bromley.
Hi, Bromley.
Hi. I just wanted to ask, so I've got this is more of a personal question in terms of I'm a fitness fanatic, and then the people around me are not as educated with their diabetic health status. So how do I, as a health, instructor, go about, say, changing someone's lifestyle where they're used to living in the herd, maybe let's say the location, and they're used to eating fast food like bunny chows and oily greasy foods, and when it comes to them into the greens, it's a total taboo. So how do I get to enlighten them and educate them in taking care of their health and making sure that their diabetic state is maintained? Because they don't actually see where the fault is, but they keep on complaining about their sickness and everything, but they don't actually know where it actually where the source is.
So Bromley, you make excellent points, and I'm so excited that people are talking about lifestyle as part of the management of diabetes more and more, and not just relying on their medication. Obviously, medication is important, but it's never going to be effective if the lifestyle doesn't fit what we want people to do. So as I said earlier, the kind of things that really matter are focusing on weight management. And one of the things we can really tell people is that especially early after the diagnosis of diabetes, that studies have in fact shown, and this obviously applies to people with type 2 diabetes, that if you can lose even just a modest amount of weight, of 10% of your total body weight over 1 year, that you've got a 30% chance that your diabetes will in fact go into remission, meaning that you have normal blood sugars without needing any medication. And I think that's incredible motivation.
Yeah.
And even if it doesn't mean that you can come off all of your medication, it's going to go a long way to prevent your diabetes from becoming more and more severe and needing more and more treatment with complications in the future. So especially early intensive changes in lifestyle have a very, very important long-term effect.
Wonderful advice. Thank you very much for that question there, Bramley.
Yeah, you're welcome. Thank you guys for the time.
Have a great day, man. We also have another call. I believe this is
Jocelyn.
Jocelyn, good morning.
Good morning, Kath. How are you doing?
Very well, thank you. Where are you calling us from, Jocelyn?
Milnerton, Cape Town.
From Milnerton.
Welcome.
All right. What is your question to Dr. Stevens?
My question is, I'm a type 2 diabetic. I am currently on glimepiride. What I wanted to know is, when going to bed at night, I have this burning sensation in my sleep. Any household remedy for the doctor, please?
Dr. Stevens.
So, Justin, what it sounds like, obviously you need to be examined, that one can be certain, but the two possibilities are, and what it sounds most likely is some nerve involvement of the diabetes. So one of the complications we refer to as peripheral neuropathy. This is when the small nerves are affected, and that burning sensation are the typical symptoms of it. And we tend to be more aware of it at nighttime because there's not a lot of other things distracting us, and so your brain focuses on that discomfort. So the most important thing is to make sure that your diabetes control is optimal, because that's going to prevent that complication from getting worse. And then there are certain medications which have proven benefit at improving that sensation and preventing it from getting worse over time. So definitely think it's something you need to check in with your healthcare practitioner about to ensure that your diabetes is well controlled and offer you some treatment to alleviate that discomfort and help you get a good night's sleep.
Jocelyn, thank you very much for that.
Thank you. Thank you, Jocelyn. Thank you, Bramley, and of course, Sonia, who called in with such great questions for the doctor, Dr. Zane Stevens. Of course, we do have some questions that have come through on social media as well.
We do. Not sure whether we have enough time, but we'll just quickly take one of them. Pinky says, my mom is diabetic. What can I do to prevent it? She was diagnosed at the age of 50, I guess, because she exercised a lot. So I guess it's the question of whether it can be, it's hereditary, basically, Dr. Stevens. What can people whose parents or whose grandparents are diabetic do to prevent themselves from contracting the condition?
So I think the most important thing is, if you come from a family, is have yourself screened. So on perhaps an annual basis, after the age of 30, those individuals should be having their blood sugar checked to make sure that they can be diagnosed early with a condition. And then follow all of these healthy lifestyle principles that we've been discussing so far. You can't do anything about your genes, unfortunately, but you can do a lot about how you live your life. And if you exercise and eat correctly, you're going to go a long way to prevent this from happening to yourself.
Fantastic. We do have another one, but unfortunately we don't have enough time. But this has been amazing.
This is fantastic.
Very insightful.
We love it.
And educational Health Tuesday, or Tuesday Health Talk. Thanks to you, Dr. Zane Stevens. We really do appreciate you for sharing your knowledge and your expertise on diabetes and COVID-19 with us this morning. Thank you.
Thanks for having me, guys.
We also had a comment, just to kind of close it off, from Morena, who said, I'm very scared as a diabetic that I will contract the virus. I clean everything with Jik. Also, you know, what precautions can I take to boost my immune system other than vitamin C, selenium and zinc? And I think the doctor has quite addressed that quite broadly, covered in terms of exercise. Just kind of have a look at your lifestyle and do everything that we know needs to be done in order to keep yourself nice and healthy out there. We know that the coronavirus is still here. And to all those who've contracted the virus, coronavirus, we know that our thoughts are certainly with you, and we wish you a speedy recovery.
Yep.
Now, to the rest, remember to take the necessary precautions to protect yourself from the coronavirus by washing your hands for 20 seconds or more with soap or an alcohol-based hand sanitizer. Wear a mask in public and only leave the house when it's absolutely necessary, because staying home saves lives. As simple as that.
And now, staying with our Health Tuesdays, of course, experience here on your Feel Good Breakfast Show, it's time for us to find out how smell helps COVID-19 survivors.